Thank you. Thank you very much. And thank you to Ravi and thank you to Anupma from Elets for inviting all of us. We have a very esteemed set of panelists here, starting with Dr. Hari, who's the chairman at Care Hospitals with all his vast experience with us. And then we have Dr. Vinod, Neeraj, Mr. Behram, and Saurabh, all from distinguished organizations you already know about. So I really look forward to this discussion that we have on AI. It's a mystery subject, honestly. While we speak more and more about it, it still has a lot of things to unfold, as I understand, within our industry. And on that note, before really I start the discussion, I was going through what do we have internally within Deloitte system. There is a recent publication that we have had, Deloitte 2025 on digital health. And I was looking at the publication, and I'll just quote a few things from that. This publication is done based on some research that Deloitte did for 4 countries and some of the key organizations in US, Canada, Australia, and UK. And I think some of those organizations are front runners as far as AI and generative AI is concerned. And not much really to come out with. It's a brief report and it's available easily on the internet, but probably I'll share it with Elets also to distribute it further. But some of the things that I just wanted to highlight before we open the discussion, they did a research, like I said, across a set of about 100 hospitals in these 4 countries. And some of the answers that came up and I'll read this out. So over 40% of global health systems have moderate to significant returns on generative AI investments. When they did the research of these 100 organizations, about 40 said that they have found some logic in terms of their investments really yielding any result. 60% are yet to really give a positive response. And I'm just throwing this as a challenge to the discussion in this hour itself, that 40% have said that they have found some result. Out of that 40%, only 10% have said significant return on investment. The rest, 30 odd percent is moderate return on investment. So that's just a start to open this discussion, and I would want Dr. Hari for you to start your response. We will just want to have an opening remark from all of you on this subject, which is, like I said, the mystery subject for hospitals. It's so complex to really navigate with all the doctor, nurses, technicians, and so many paraphernalia around. So Dr. Hari, your comments, please.
Yeah, you started off saying it's a mystery subject, and the biggest mystery that's happening around the world is Trump. What he's going to do or what he's not going to do. That's, I guess, the biggest mystery.
Yeah.
And the Junior Trump, I was just listening to Junior Trump. You know who is now? Elon Musk.
Yeah.
So I was just listening to an interview of his recently. Somebody asked him, you're stopping all these people from immigrating and you don't want skilled workers. Well, where is US going to go? You don't have enough number of people. And his answer was, we don't need. We have enough to do. We can manage without all these people. Then the presenter asked him how. He said, you go to Grok. Grok will do everything. Grok is his AI platform. Then he said, what about healthcare? He said, I've just worked with, just chatted with the guy who was doing healthcare on Grok. And he told me that the MRIs or CT scans or X-rays are read with better accuracy on the Grok than by a radiologist. So you don't need radiologists. Why do we need radiologists? You just go, he was selling his AI platform. So there's a huge hype which has been created around AI and in healthcare. That hype has created the mystery. And I really believe that healthcare, the human resources part of it, is never going to be replaced by AI or any AI that comes in the future. But what it is definitely going to be there, we all need to be prepared for it, is AI is here, it's going to grow, and it is going to grow in a direction where it will sit on top of what we're doing. It will sit on top of what we're doing and help us to do the things better, faster, quicker, more accurately, with less errors, and in a cost-efficient manner. I think that's broadly my take on what AI is going to do in healthcare. And there are basically, in my view, 4 stakeholders when it comes to healthcare. One is the patient himself. Then the second is the providers, all of us who are starting from an administrator to a doctor to a housekeeping, all of us. Then the third is the payer. It may be the government, it may be the insurance company, it may be anyone or out-of-pocket payer. And the last one is the community. It has to impact one of these stakeholders in a positive manner. Only then it's going to make a huge difference. At this point of time, we have seen solutions which are impacting many of the stakeholders, many of the 4 stakeholders, but the real outcome-based, clinical outcome-based AI is something which we will all have to wait for, because we don't have one which is really can claim that it is improving clinical outcomes. All we can say is there are some systems in the world which are reducing errors or identifying errors earlier, but none to say that the outcomes are improving. So I think that would be the pinnacle of AI in healthcare, and we need to. My opening statement is AI is here to stay, and we need to learn to live with it and grow with it.
Sure, thank you. Saurabh, you want?
So thank you, Abhishek. I think I will agree a lot to Dr. Hari. So AI is here to stay, and how it will shape up, actually none of us know, because we are at very nascent stages of AI, and especially in healthcare. Healthcare, unfortunately, has been a laggard in adoption of AI and other technologies. So 3 things will happen. So first of all, we can actually learn from others' mistake, because AI will actually anything which is implemented will not be the first in healthcare. Healthcare will always copy from other industries like aviation. So we will have that benefit, I think. The second thing is there is a core offering and there is an augmented offering and the other paraphernalia. So the core offering remains the treatment, the clinical part. I think we are nowhere near of clinical substitution by AI. So doctors and other medical workers will continue to do their job, which will be enhanced. The access to medical service will be enhanced. The capacity will be multiplied by a lot of AI algorithms in diagnostics. So that will be there, but we are nowhere close of a clinical substitution by AI. The third thing is there will be a lot in offer for the patient experience part. So there are, patients are very much mature now. They understand what is happening. And there is a lot which AI can do with patient experience to the non-medical stuff. Not just, by automating stuff, by actually better communications. Majority of us are already using AI in our chatbots. We are using in estimators, the bill estimators and other things. So on the patient experience part, I think there is a lot which AI has to offer, and that will significantly reduce the burden on healthcare providers for all the non-medical and non-core work. So that's my thought.
Thank you. Vinod?
Good morning, everyone. I didn't expect that first question is we are going to discuss about, 60% is already saying that it's not working very well and 40% is working very well. I mean, that's put us in a very tough situation. So I would go with what both the colleagues said. AI is here to stay. But I think so the learning curve for us or probably the growth for us is going to be a little slower. I'm talking about the core AI. Core AI, when I talk about precision medicine. I'm talking about the robotics, wherein the investments are going to be very, very huge, because quite a large amount of population is still paying out of pocket, and you have to continue paying out of pocket. And though there are a lot of merits of getting into AI, but we are a country which is extremely price sensitive. All the CEOs, every day wake up by getting some announcement which says that, your price is going to be slashed on a medicine to this extent, on certain services are going to be this extent. So because of that, it is going to be little slower, because end of the day, the price, whatever you lose, the investment, what you do, since we have spoke about ROI, ultimately the patient has to bear it. So second thing is, when we are looking at, we are still governed a lot by package billing. And in package billing, it is still not well accepted. A part of it is insurance companies are giving it, but not completely. You still need to have co-payment coming into it. There are still capping. You have your old policies. They need to be, taken up. You need to revamp them. So those things are there. Government packaging is still not accepting, the part of the investment which you are doing in AI. I'm talking about the core AI. So this is going to be a challenge. Third thing, what we are talking about, the cost effectiveness in terms of overall manpower. So we have hospitals which are already there. They have done their manpower planning, and there are sufficient manpower which has been taken on board. So when you bring in AI, what happens to the existing one? It will take little time, right, to get you as a cost benefit. When you are starting a new hospitals, that's where, it could be adopted and you can start getting the cost benefit. Having said that, it has its own merits, and we all have spoken, both my colleagues have spoken about it, and it will continue growing. Considering these 2 points, I see, it is there to stay, but the growth curve is going to come little slow and steady, because everyone is watching about it. The data, what we are looking at, the regulations around it, we are seeing how well established it is, because there are many companies who are providing you plenty of precisions, but we are still watching, from where, who is governing this entire thing, from where this data is coming. Considering this, maybe another 2-3 years, or maybe 4 years, and we see people using lot AI tools, rather than immediately next 1 or 2 years. Thank you.
Sure, thank you. Neeraj? Yeah.
Thank you very much. I also support this. AI is here to stay. I think AI is making the processes more fast and more smooth. I'll give you an example. Yesterday, I was in one of my hospital in Pune, Medicover Hospital. We have launched an ortho robot. Like in the morning, Dr. Jiten Sharma was talking about Made in India hospital. So that is a purely Made in India ortho robo. So the difference between a ortho robo, AI-based robo versus a mechanical. So it has reduced the average length of stay. You can simulate the entire surgery prior to the day of surgery, and the bone cutting, which is very, very accurate, which you're talking about precision medicine. I think there is a good mix of AI as well as some processes which is driven by clinicians. So I think AI, everybody has to accept, whether 2 years, 5 years, or 10 years down the line. But I think patient care and experience, that is very, very important. You cannot replace doctors, you cannot replace paramedics, and there is a good balance. Say, for example, our staff nurses are using tablets and iPad. We don't have a patient file. And if you see a patient file, the average number of paper in the patient file is around 100 to 200 papers. And if you are supposed to write all those things on the patient file, you may sometime have a problem. So AI can help in these issues which can be solved in the age-old healthcare. And I pretty support the statement, AI is here to stay. 2 years, 5 years, 10 years, the time has to say. And the real healthcare is tier 2, tier 3, and tier 4 cities of India.
Thank you. Thank you, Neeraj.
Thank you, everyone.
It's working. Yeah.
Yeah, just to answer this question, AI is definitely here to stay. There's no question of that. I mean, it is there in various ways. It is there in the medical equipment we use. If we are using a robotic surgery system and equipment, it is very much embedded in that. I know in Ruby Hall Clinic in Pune, we have advanced radiology equipment. AI is very much a part of it. Even from the clinician standpoint, it is like having an extra pair of hands. an extra pair of eyes for that. It is like having a second opinion in real time. It picks up a lesion where the clinician may not be able to pick up. The AI algorithm defines that and picks it up. So those benefits are very much there. To answer your question, Mr. Abhishek, whether there is value in that, value cannot be just, quantified in rupees and paisa. If my discharge time is getting reduced, if my admission time is getting reduced, there is value. There is, the people are getting released for empathy and compassion, which is very much there. So it is there, definitely.
Yeah, you're right, and I agree with. Of course, these are obvious answers, and we all agree with the same. And just to add to what Neeraj said and what Vinod, I think we are all already seeing impact of, for example, linear accelerators in cancer care, looking at precision movement of patients while the radiation is happening. I think that those are already applications of AI which we know. But I think when more AI is being spoken about, we are talking of hospital operations. A lot of equipment related, technology related stuff is coming in, and we are adopting to that. But when it comes to the departmental communication between one to another, I think that's where the real challenge probably comes in. So in fact, that's my second question. In the today's context, AI of course is one element, but within the digitization of healthcare, whatever extent we have, any comments that you may have on the challenges in the digital adaptation, and which also is in the direction for AI? And Behram, why don't you start? We'll start from there. Yeah.
The main challenge I feel is not so much in the AI itself. I mean, it's the integration, because whatever comes in, an AI or something comes in, if it is not integrated well, then probably it has it can cause disruption. So integration is very important. How you integrate, that is very, very important. The second part is, of course, the trust. You must take all your clinicians, your staff, your doctors and everyone into confidence, have proper communication. If the trust is established and if they feel that whatever this is, whatever AI or new thing it is, and if it is going to benefit them, they will adopt it. Third part is, of course, the data. The data has to be clean. If the data is clean, then of course, the integration and everything follows. So this is very important.
Yeah, Neeraj, your comments on that?
So I'll just give you some practical example which is happening in the healthcare. No, data is not talking to each other. If you enter to the hospital, there's so many software and platforms are there. So what most of the laptop managers, they do, I use the word laptop manager, they pull all the data, present in some format and show to you. Like any review which is happening in the hospital, it is data, Excel sheet and PowerPoint presentation. I'll give you an example of Medicover Hospital. It's a European-based company. We don't do reviews with the presentation. We have a live super app which is available. I was sitting here for 1 hour. I have approved 10 purchase order. I have approved 5 indents. I have seen what time the doctor checked in, what time he checked out, how many patients he has seen, and what is the PNL now. So I think these data are important. Now the managers are on the move. So if these AI-driven tools help us in taking decision. See, you are taking decision based on what? Right? Based on because he's a star doctor, number one. Based on the decision whether this will help you or not. So I think these are the things like a nurse, a poor nurse, if you spend time with her, there is an AI tool. When I was in one of the hospital in Bangalore, there is 4-point system is there. So there's a nurse call bell system which you used to do. A patient has to press the nurse call every time. Food is not good. My bathroom are not clean. I want a light should be put off. So she is going inside the patient room for most of the time. So what they have done, they have given a remote control device where they have to press for housekeepers, for maintenance, for nurses and all. So this is escalation to the various vertical HODs. And the TAT is given 5 minutes housekeeping, 10 minutes food and all. So 33% of her work is sorted there. So she has only been called when it is asked for. So I think if these kind of tools are used, it will ease the operation and it will improve the patient care and experience.
Yeah, sure. Vinod, in fact, while you respond to this question, specific to you is you are a hospital which is a standalone hospital versus the others which are, in a chain, and investments in healthcare from a technology point of view for a chain might be slightly easier per unit, let's say. For you, from a challenge point of view, being a standalone hospital, any comments that you may have?
Yeah, I mean, the challenge is definitely when you look at, you would definitely look at the ROI. Like that's a hard truth, but like somebody need to talk about it. So say for example we are talking about robotics. Like let's talk about the ortho robo. You are going to put in anywhere, maybe close to 2 crore to 8 crores, depending upon what model you're buying. So, and you are going to pass on that additional cost to the patient. You need to recover your robo expense. You are also going to bring into the table additional consumables, right? So that is also going to happen. And your patient clientele may not change. You are trying to offer them precision, but there are a set of people who would actually like to go for a more precision, accuracy, scalability. But there are two other areas which we need to look at: the feasibility and a sustainability when you come to a standalone place, right? So these are the challenges which, having said that, that doesn't mean, we are not going for a AI base. We are evaluating this risk very thoroughly, and we are looking at the benefits of it. And that's our standalone hospital, like us. There are many other hospitals would go for this technology. Now, another area which I feel would actually help AI is also the hospital information system or hospital management information system. We all have adopted the hospital management system at a different time, and we have adopted the different the applications which are there. So you need a great amount of standardization there as well, because a lot of data is going to get picked up from there, and it is going to get into the system, which are then going to work on developing the AI. So today the data management, like I remember when we started getting internet free, I was so damn happy, but at the same time I was amazed that how it can be free. There's nothing free in this world. And then I realized that giving you internet free is not the product. You are the product, because you are giving the data. So I started thinking that, look, internet is a product and how it can get you free. So then once you study it, you realize. Similar way, our data capturing today is also in a very, very fragmented manner, as Mr. Behram said. It has to be a very clean data, because whatever data get captured, it is going to get fed into the systems. And on the algorithm, that's how the systems are going to work. So we are still waiting to look at the regulations around this data management, which is a larger picture which we would like to see. And also, I think so we are also going to touch base on that point of the data privacy and the protection, because we have couple of AI based equipment, and some of my doctors refused to look at it. He said, I would still like to look at the actual study, and I would like to give my interpretation, because end of the day I'm going to sign on it, right? But if somebody is managing something very remote, like somewhere around 50 or 100 or 200 kilometers, the primary diagnosis could be done. But in a larger setup, when doctor is signing, for example, there are echocardiography machines which are AI based, and there is a lot of studies which has been put into it. Your cardiologist still would like to, look at the study and then give those details, because it is still not clear in terms of how accurate the data is, from where that data has come. We are very geographically very diverse. Just having list of the patient gives you a proper answer. Doctor, we have a very senior person, which is Dr. Hari Prasad. We would expect at some point of time he would also talk on this, because it's a faith in the system, and that faith, apart from administrators, apart from promoters, I think so that faith need to be also built in the doctors, because end of the day they are the one who who acknowledge it.
Yeah, thank you, Vinod. In fact, Dr. Hari, to you, in fact, the point from a standalone for your organization, which is multiplying pretty much in a few months' time, care with KIMS, Kerala, and then Aster. I think that scale, any comments with that scale, what allows you from a digital intervention point of view and AI and etc.?
I mean, for any organization, I think ROI is critical and investments will be made into areas where ROI is expected. And obviously, one of the most important precursor for AI is digitization. And unfortunately, I can vouch for this, that the ultimate goal of digitization in healthcare is to run a paperless operation in a hospital. And I can vouch that there's no hospital in the world, not forget India, no hospital in the world which is paperless at this point of time. And that is a clear indication that the emphasis needs to be on digitizing the entire thing. There are some areas which are digitized because they are paid for it. The biggest culprits when it comes to the challenges for digitization in healthcare are the doctors. And I can vouch for this, having seen this for 30 years, generations of doctors. It doesn't matter. A lot of people said the older people are not adopting it. The younger generation is going to adopt it better. It's no better. So I think first thing that needs to be done is the doctors need to be onboarded, because it's not about procurement, it's not about inventory management, it is not about attendance management, it's not about staffing patterns. I think the biggest value of AI needs to be, in healthcare, needs to be impacting clinical outcomes. And impacting clinical outcomes will only happen when we have the clinical data on the system in a readable manner. There's no point in having all data which is, talks different languages for the same disease. We need to have data which is readable, which is consistent, which is standardized, and that is useful for machine learning, and then the AI solutions will come out of it. So I genuinely believe that if you really want the patient at the end of the day to benefit from AI, digitization must be complete, digitization must be standardized, and from there, the benefits, clinical benefits, I am again re-emphasizing that the ultimate value that all of us as healthcare providers need to look at and need to deliver is first great clinical outcomes. Everything follows, everything else is secondary. So if AI has to justify ROI on it, it needs to first deliver good clinical outcomes. It needs to help in improving clinical outcomes, and it needs to help in making sure that there are lesser clinical errors. It needs to help in making sure that the patient is out of the hospital as soon as possible, less complication rates. There we have an opportunity, and I think that in the next couple of years, that's the direction that we're going to move towards. If you don't like it, then I think healthcare is not the place for you in the next 5 to 6 years.
Yeah, thank you. Very well said, sir. Saurabh, your comments?
So I think the esteemed panel members have covered it all. But one thing I would like to emphasize is what is the base of AI? Of course, clean data. But let's talk about knowledge, skills, and attitude. So we do an excellent job as hospital operators to communicate how AI products are beneficial. We are using cutting edge robotic tools or robots for surgeries, AI algorithms. But somehow we actually fail to do a proper internal communication. And internal communication is very important to tell our doctors, our staff, how it will benefit them. So what happens, I've seen this, that, there is always a resistance because they do not understand how AI or AI based product will make their life easier. In one of my, so I actually commissioned one of the largest hospitals of Medanta, which is Lucknow, 1,000 bedded. And we had a mix of doctors. So some of our doctors were from PGI and, King George's, very accomplished, but, somehow a lot of gray hair. So, to my surprise, some of these doctors were actually our champions for AI because, when we explained how it will help them to actually see more patients, to reduce some of the clutter, then they were my champions, and, they were taking lead. So we actually work with Ogneto in AI-based prescription, and Ogneto is now one of the best prescription, voice-based prescription. So they worked with us for 3 years, and, you had Dr. Sharma and, Dr. Bhagirath, who were actually champions of it. So when we did internal communication, it was much easier for us to navigate. The other thing which my fellow panelists have already spoken about is the use of clean data, because, AI works on ML, machine learning. Machine learning is nothing but the algorithms which are based on the data you input. Now, how to clean data, how to input clean data, we are actually experimenting. There is a Japanese concept called Pokayoke, which is mistake proofing. Now, one example is pin code. Pin code itself is such a beautiful parameter. You can do so many analysis, and Neeraj can agree. Just by pin code, you can do the, so many analytics in Power BI and, real time. Now, half of the time, this pin code is wrong because it is not entered properly by the front office attendant, because they do not understand the importance, and there is huge load, so you cannot just blame them. So what we are doing is we are integrating, the entire database of the pin codes with the HIS, and as soon as you enter, it will tell you whether it's correct or not, and you cannot enter anything. It has to be a pin code. So that is a mistake proofing we are doing at the back end. So AI is helping us. Now, just by doing this, 95%, over 95% of my data will be correct, and I can generate beautiful reports. So that is very important, how you can actually empower people by mistake proofing. So those are my 2 thoughts, Abhishek.
Thank you. I think very diverse opinions and views, and it's all in the right direction. Dr. Hari, you mentioned the emphasis on the clinical piece within the whole digital element, and I'm digressing from the AI angle because it's a related logic. And excuse me, that I'm digressing on this. We are also hearing ABDHM, the Ayushman Bharat Digital Health Mission, coming in. Your statement, Dr. Hari, that you made, that ultimately we have to go, I think it's also happening that the government is also pushing some agenda from top down. And what you were saying was from the bottoms up. Is there a convergence you see now in the near future with ABDHM coming in some shape to the rest of the hospitals? And your comments, I think, have you heard, all of your organizations, have you heard something about ABDHM, and are you preparing something about it?
I think anything which is coming up which would benefit any of these 4 stakeholders I spoke about is great, and we should welcome it. And I think ABDHM is a great initiative. And with the diverse population that we have, the diverse geographies that we have, the diverse socioeconomic statuses in different geographies that we have, the number of tiers of cities, villages that we have, I think it's going to take a while before it becomes completely implemented. And for something to succeed in this country, I think it should be both top down and bottoms up. Only then I think it will work. And Ayushman Bharat, for example, is a great scheme. But I can challenge you that majority of the high-end hospitals are not encouraging Ayushman Bharat at this point of time because they don't have the buy-in. It was something which the government thought about, did not discuss with the stakeholders, bought in the scheme, and it was not in line with what the stakeholders wanted. So I think there needs to be a dialogue between the policymakers and the providers at the end of the day to be able to create something which becomes universal in nature. And if something becomes universal in India, let me tell you, it has become universal in the world. Because we
Yeah.
maybe represent 1/5 of the population of the world. And it's something which we're doing for the rest of the world.
Correct.
And in this diversity, the ABDHM or any other thing which is able to even reach 70-80% of the potential that it has, it would be a great thing, and I think we should all support that process.
And I think the related subject is also the regulatory environment with the digital top-down being pushed. I think the digital, this regulatory piece as to how we are converging the data, I think all that will come into play. Complex subject. We are all hospital administration people, but I think somewhere.
No, I think there a lesson has been learned somewhere.
Yeah.
The Digital Health Mission was supposed to come out with the guidelines long time ago. There was a bill, a document which was prepared and ready. But I think now the government has understood that it needs to get the stakeholders onto the table and
Correct.
discuss it with them. And that's right. That's the right approach to it. And that's why it has caused the delay. Otherwise, it should have come in about a year or a year and a half ago.
Yeah.
And I think the process is on. And I think when it comes out finally, it will be with the input of all the stakeholders, and it will be more acceptable than what it would have been if it came down just top.
Correct, correct. Right. Vinod, your comments on this? The ABDHM and related aspects. Any comments from you?
I think so. It's very necessary for all of us that the digital health mission we all support and it becomes successful, because these are very indigenous data, which is very peculiar to India. A lot of our disease patterns, symptoms, the way how we eat, what activity we do. So our symptoms, our treatment, our diagnosis are a lot similar to this. So I think so once we have this pool of data, it's going to be extremely important. And that's where I think so a lot of decisions are going to be more precision based, because people stay at certain elevation, their hemoglobin levels are very different than the people who stay at certain different elevation. So once we have this data coming in, we as a country can zone our data, and that data could be more relevant when we look at it. People say, for example, if a doctor sitting in Pune or this part of Maharashtra, for him or her, it's going to be more relevant to have a data which is from a western part of the India rather than a northern part. So it's going to be extremely important for all of us, and we should look at it. Now coming to this bill which actually got drafted in 2022 of the privacy bill. I think so it's a very good move, because as I said before that there is nothing free. The internet was not free, but the data everyone is trying to consume. So it's in a way to look at internationally also, like how we can restrict. One is that how we can streamline, and how we can restrict the giants not to take our data out, and then it's a property, it's a gold mine, so it remain with us. So government is also trying to play a role at that, saying that once we have this bill formally coming in, the penalties are coming in, then the data can move freely, but there are going to be gatekeepers. It just cannot go the way how it is going right now, and then dump can given to the people, and people can monetize it, people can market it. So it's a good move from both the side. Digital health mission is going to be important. At the same time, when we are encouraging this bill is also going to be extremely important, because privacy is something which is very much needed. Right?
Sure.
Thank you.
Neeraj, any comments from the preparation? Have you seen any communication coming to your organization for that matter from?
This is good. Like when I was in Gujarat, so we are having patients from 3 states, and they're coming fully paperless. There no need for approvals. Madhya Pradesh, Gujarat, and Rajasthan, the state which operate this PMJY. So there is no need for approvals, sending this thing. So I think it is good. But I think percolation, like Dr. Hari was telling, stakeholders are not involved fully. So for example, we operate in Mumbai, some of the CGHS driven companies. So our OPD, every day we do around 700, 800 OPD patients, but still 100, 200 bills we have to generate manually. Why? Because it is a need of a stakeholder. They will not pass your bill unless you submitted hard copies. But all the patients are very happy. We are sending their prescription to their WhatsApps and their mail and everything. A patient is entering to the hospital and going away without a single piece of paper. So I think if every stakeholder is not becoming a part of this big mission, so we are losing the bus. And that is, I think that is a very important. So whatever private and corporate hospitals are do, if they're not talking to each other, it will make a difference. Like Saurav was talking about PIN code. PIN code is very, very important. We, as a KPI, we used to track, how many patients PIN code has not been tracked. And this help us in taking the business. We can track how many patients is coming within 5 kilometers, within 10 kilometers and all. So I think these kind of tools will help us to take the decision which you can take with the help of data. It is just not, you are not taking the decision just like that. But I think government is doing great in the term of digital. You see Digi Yatra, you see, Digi Locker, UPI and all. This is a fantastic thing. And I'm thinking same thing will come in the healthcare also. When we got a health card which can be operable across the hospital in the country, and all your vitals can be seen there. So I think that is a way forward.
Yeah, I think some convergence will surely happen sooner or later. Yeah.
Now, just to add to this, as you rightly mentioned, the top-down thing, it's not only the Ayushman Bharat, even at the state level, you have the Jyotiba Phule scheme, which is also being, imposed top-down to particularly to the trust hospitals, maybe not so much to the corporate hospitals. And that is something, as everyone is rightly pointing out, without the full confidence of everyone and without communicating the whole scheme to all the stakeholders, it becomes a little difficult. So I think the main question in this is, of course, the rates and how you're going to implement, because it is an insurance-driven scheme, but the rates and everything which are given in that for all hospitals, not only for us at Ruby Hall, but for everyone, I think that is a big challenge. The payment methodology is also, the payment time taken is also a big challenge. But of course, it's a very good scheme. If it is implemented in the proper way, then it's going to benefit the citizens of India entirely. The second part is, of course, all this, the data, So anonymity of data is very important. I think the privacy bill does cover that. Consents are very, very important. And also as a nation, we have to make sure that all this data, not only the digitized data, but the clinical data particularly, does not go out. I have been approached, by foreign companies to share, particularly the onco data, to share with them, and they have offered crores and crores, They claim that it is all legal and everything is there, but who knows? Sometimes the technology keeps pace and the law does not keep pace with that. The technology moves far ahead, the law follows behind, it doesn't even know what's happening. So what we may do today may become illegal tomorrow. So we all have to be very, very careful about that. All the data has to be anonymized.
Yeah, very important point. I think it's a touchy subject and one has to tread very carefully. Saurabh, your comments on all the digitization and related aspects what we spoke?
So I think the data protection bill, which came in 2022, was actually the first step. It's a remarkable step. However, the way things are changing, we actually need more standards. Now, the data protection bill only talks about the data protection privacy, but how to use AI, what is the limit? Can you use AI in diagnostic, or going forward, like somebody was talking about the Digi Yatra. No, Digi Yatra is an excellent concept. Can we do something similar in hospitals? Can we use a paperless mechanism? Somebody just walks in and by biometric registers him. The whole patient experience will transform. Now, can it be done? What standards are there for AI? Because there are a lot of countries which are now, of course, states is a leader, but there are, work happening in Germany, there is work happening even in Turkey and other. I was reading about it. They're coming of the AI standards. Now, I think that is the need of the hour. So, AI standards, where, up to what level AI can be used in therapeutics, in healthcare, that is the need of the hour. I think that is something probably the government is looking at. Of course, data protection bill was the first step, but we need proper AI standards.
Thank you very much. I think it's a wide subject. Our times are up for this panel, but before we say Dr. Hari, you have a comment?
Yeah, I just wanted to add to this. A lot of what we spoke during the last 1 hour probably leaves behind a doubt in our minds that is it going to happen? Let me tell you, it is happening, and I'm telling you it's happening across all sectors. If you remember, those of us who used to travel abroad used to stand in those long immigration lines, face a rather rude immigration officer, get it stamped and then go out, or come, even when we come back to our own country. Now, yesterday I got myself, now the immigration is started, so I got myself registered. Yesterday I came back, and it was such a pleasant experience. I didn't have to wait for a second. I went to the gate, did everything myself. The photo was taken, I scanned the passport, and I was through it within 60 seconds. So it is happening. So let's all be positive about it, and let's all contribute towards it. I think that's the more important part of it.
That's the punchline. Start with the negative, the mystery element, but surely it will happen gradually. Time will take, but surely things will happen. I'll open this for the for any question and answers that anybody from the audience may have. And for the gentleman there. Should I pass on the mic here? I can pass it on from here. That may be quicker.
Thank you. I think, Vinod, you raised the point quite well.
Sir, could you introduce yourself?
Yeah, sure. My name is Marzban Barucha. I am from 14th Degree Azimuth. We are a set of advisors who are working on data privacy. And this is something that you raised very well. It's as we talk more and more of AI and data compilation, the Indian government and many governments across the world are talking about data privacy, and it seems to be at a junction where it may clash. I would like, Doctor, if you could give some, some of your thought processes, and maybe other people on the panel on this subject. Thank you.
It is a very, very touchy, difficult subject. But I think that we'll all have to agree that the data belongs to the patient. And the data, the rights on the data belong to the patient. That's one aspect of it which we all have to be very clear about. The other aspect of it is, how do we use this data? Because this is a gold mine. I'll just give you an example. We all clinicians work on laboratory values, which are all based on Western studies, and I'll use this word, are irrelevant to the Indian population. I'll take one example of a lipid profile. The normal lipid levels of a Caucasian are significantly different from the Southeast Asian population. But we treat based on the books that we read, which are all based on Western population. Now, we've not been able to create the normal values for our own population, and the only way you could do it is by gathering data and putting it through machine learning and arriving at a normal data. So I think there are two sides of a coin, both of which are equally important. While it does belong to the patient and we have the responsibility of maintaining that privacy for the patient, we also have a responsibility of using it responsibly to make sure that the patient benefits from it at the end of the day once again. That's my take on it.
Thank you. Any other question? Yeah.
Can you please introduce yourself as well?
Hi. I'm Kuze. I'm from a company called Siam Computing. We are technology partners for it. We talked about AI a lot this morning, but India is a price-sensitive, cost-sensitive market. It's an open question to any of you. What are some one or two immediate AI implementations that you're seeing that is justified from an ROI perspective in any of your organizations?
Want to take? I think just my first reaction is patient engagement. every organization is adopting to. How do you engage the patient and make the patient stick to you, make the patient buy medicines from you, whatever has been prescribed? Yeah, you want to add to that?
So patient engagement, in fact, previously also I said that would be the biggest, factor for implementing AI. We have seen AI chatbots, literally everybody using that. The second thing is the diagnostics, because nearly, I think, majority of the corporate hospitals are now using diagnostics algorithms in radiology. And that is a use case because it significantly multiplies the capacity of your radiologist. So instead of 200 X-rays or reports actually coming at their workstation, you get only selected reports. So that multiplies the capacity, and that is a clear case of ROI. Then there are other examples on stroke detection. It detects things much easier. Prediction on discharge. It generates scenarios. So we have seen that the estimate generator, we have tried that. The accuracy is over 99% because it actually pulls up the data, archetypes with the patient, to the doctor, the previous 6 to 8 months consumption, and you have over 99% of accuracy. Of course, there are medical cases, some of the length of stay can go up, that significantly differs. But otherwise, we have seen use cases when it is 99% accurate. So these are some of the cases which are already in use in Indian hospitals.
So I'll just go ahead. So, your question to answer that is, any offering we are doing in AI, or for that matter anywhere, it has to bring solution to the problem. You can have an offering which are solution based or enhancement based. So enhancement based in our kind of scenario is going to have a priority list in a scale of 1 to 10. It is going to be 10, 10 being lowest. But if your offering is going to be a solution based to the problem of healthcare administration and healthcare work together, but they are separate. So we are talking about core healthcare. Then if you are offering a solution which is going to add value to core healthcare, it will be accepted. I'll give you a small example. We back at our hospital run a CSR program wherein we have adopted close to 800 juvenile diabetes program. It is led by a very, very senior and pediatric endocrinologist. So he was talking to me that day and we went for that offering. He said, imagine those kids have to take an insulin, right? The kids who are born 6 months old to quite grown up. Taking those insulins twice, thrice a day is a little difficult. But he told me, look, there's one solution which is coming in. The meter is going to read what is the sugar level. And on the other side, the infusion pump is going to, give the insulin. Now that's a beautiful solution. And there are a lot of people who will be happy to help you because it's adding a solution. Otherwise, imagine kids are in their own mood. They are not like us who are going to maintain the timetable and they are going to take the insulin. Who is going to read, what is the scale? Parents are somewhere else. Unfortunately, morning they are left in the school or they are at home and parents are working. So and we spoke about this, this retinopathy. So if any solution which is going to address to the problem, it will be well accepted because that's where the junction wherein we are right now. Any announcement may be accepted, but accepted by the privileged one. So that's the answer to